All right. Hello, Ms. Cheryl. Thank you so much for being here. Would you like to introduce yourself?
Sure, thank you, Elliot. My name is Cheryl Panosian, and I am a licensed professional counselor, and I work at Milford High School's School-Based Health Center, and I've been there since March.
Since March, wow, so almost a year. Could you tell us a little bit more about, what is the School-Based Health Center?
So school-based health centers, as a program started in the mid-'60s, believe it or not. And they started in a few communities to bring care to students in school. So what they include is both physical health services and behavioral health. They also will have sometimes dental services in the clinic. In New Milford, it's just me right now because the medical hasn't come yet. It varies from location to location what is actually in the school-based health center. It provides affordable care to students in the school for both the physical and mental health services. So we do offer free counseling. If a family does have insurance, then we bill the insurance, but we don't collect co-pays or deductibles. So it's very affordable, and with the medical component, students can come. It's usually an advanced practice nurse, registered nurse, or a physician's assistant who can see the student in the school.
Oh, wow. Wow, so there's really all-encompassing, it's a clinic within the school. So what is your role within this clinic?
My role is I am the counselor. So I provide individual and family counseling to students within the school. So since March, in the beginning, I was here just 1 day a week. And then came the fall, I'm in the school building 4 days a week. And that will, in September, change to a full-time 5 days in the school. And since then, I've provided counseling individually to students, one-on-one, but I've also engaged families. And what I mean by that is I think it's best when it's feasible to engage parents. So I've met and done some parent sessions just with parents to help them understand what their child is going through and how to best help them. But I've also worked with 12 different families in family therapy. So parents will come into the school, I'll meet with the student and the parent, sometimes both parents, around the issue that the student is having. And it's been very beneficial, I think, to both the student but also the family, in helping improve communication and dialogue and to identify what support to put in place.
Wow. Yeah, I had no idea. I thought it was just for students. Is it during the school day, or is it also outside school hours?
It's during the school day, but the school day sort of stretches. I have seen people at 2 o'clock, at the end of the school day, and being an early bird, I'm in the school at 7 o'clock in the morning.
Oh, yeah.
So I have met with parents at 7:15, and I can also stay a little bit later past the end of the school day to meet a parent's needs.
Mm-hmm. Wow. And so how do students go about accessing these services, or would parents get involved, or how does that work?
Typically what's happened, because the program is relatively new, the referrals have mostly come through school guidance or administrators, but some parents as well. Mm-hmm. So there's just a permission form that a parent has to complete. It sort of gives consent for me to see their youth. If you're over 18, you can sign yourself. And then once that permission form is signed, I can meet with the student. So it's simply a referral. I've had a few students refer their friends. So just in the little bit of time that I've been there, and they have given the form to their parent to fill out and complete.
Mm-hmm. Wow. Yeah, that seems that's a big step for friends to be able to help each other like that. Where would you find these forms or find these resources?
So right now, outside my office, and I'm directly located across from the guidance suite, which is very convenient. And there's a bulletin board right outside my door. So I have a lot of this information posted on the bulletin board, and I keep some permission forms along with a welcome letter for parents that explains what the program is, the cooperation between New Milford Public Schools and my agency. So I actually work for an agency called the Connecticut Institute for Communities that is main location is in Danbury, but we have school-based health centers in Danbury, at Abbott Tech, New Milford, the other schools in New Milford, as well as Newtown Middle School.
Oh, have you worked in other schools with the school-based health center?
I have actually, quite a while ago. I worked for 10 years in school-based health center.
Oh, yeah.
So I had that experience, and then I, kind of transitioned out of that and came back.
Yeah. Yeah, and you like it, I'm assuming?
I love it. I really do.
Yeah.
And, this is sort of a plug for the school, but I think the staff there has been very welcoming and collaborative with my agency and with me personally in the role that I'm in.
Yeah, that's really nice. There has to be that cooperation
Right.
for it to be successful.
Right.
Well, I was going to ask if the school-based health center works with the nurse's office at all through the medical services, but
Yeah, and that's not happening yet, but typically that does happen. So typically what happens if a kid goes to the nurse and the nurse thinks, oh, this kid might have strep. Once there's a clinic there, an APRN, they can do a strep test and find out if the kid has strep.
yeah.
And also prescribe. So it would be they work in collaboration with one another, but right now that hasn't occurred.
Yeah, so when did the New Milford High School School-Based Health Center start?
It started in March. Yeah.
Yeah, with you?
Yes.
Were you the first person to start it
I
at
was
all?
the first person.
Wow.
Yeah.
Is that the first time you've done something like that, where it's sort of been you've been there from the start?
Yes, it is. This is the first time that I've been the first person in that role.
Oh, interesting. I wanted to ask, what are the advantages of the school-based health center as opposed to outside services or counseling?
Well, one of the main advantages is the convenience of it being right in the school. So oftentimes parents are working and they may not be able to get their child consistently to an appointment, but also, some kids work, they have part-time jobs, they are in a sport or something, and it interferes with being able to access that. So it's the accessibility, right there, but also the affordability, because like I said, we don't collect co-pays, or if a family does not have insurance, we do not bill them.
Okay. Yeah, that's amazing to have that service. And I'm going to go out on a limb and say the answer is no, but I want to ask, just to double check, can these services be confidential, or the parents have to be involved?
Yes. So services are confidential, and what does that mean? Well, what it means is that the services are confidential. The parents do have to sign a permission form. However, what is discussed is confidential unless someone's being abused, threatening to hurt themselves, have more serious symptoms.
Okay.
So if somebody is endangering themselves or others, then we have to break confidentiality. But otherwise, people, confide many things that I am the keeper of that confidentiality.
Yeah, it's just between you and the student.
Right.
All right. Yeah, thank you. Is there anything specific or that we haven't discussed yet that you'd like to share with parents and students?
Yeah, I think the way I see my role, I am a parent also. And I have a almost 21-year-old and an almost 18-year-old. And parenting is a very hard job. I think as a kid, you think being a kid and going to school is a very hard job. But parents are also juggling their own emotional life, their responsibilities, and I feel like my role is to help families as a whole. So, and that starts maybe with the child and finding out what their needs are. But I am not, and I've said this many times in my office with the families that I have met with, is I am not a judge. I'm not judging anybody's parenting. I'm not judging anyone's child, I'm here to help, and I think that's my passion in the work that I do, is that I want to facilitate healing.
Yeah.
I don't want to point fingers or make people feel inadequate. It's really to engage and figure out what are the best solutions for what their youth is dealing with. And I feel like with the families I have had this relationship with, it's been successful.
Yeah, it seems like a really invaluable resource, and especially since it's like right there. It's easily accessible and is an easy resource there.
Yes.
But I am going to be honest, one of the first times I've noticed the like actual door for the school-based health center and like the location was like today. And so I wanted to know if there's like any way we can find out about it online. Is there like any online resources?
Well, I believe that there is going to be an online presence, and they're working on that.
Yeah.
They're working on that because when the school-based health center started in New Milford in March, it was just New Milford High School and Schaghticoke. Now it's expanded to the elementary schools. So, and that just happened this fall. So there will be an online presence with the information, et cetera, right on the web page.
Okay.
So
Yeah.
I believe that's coming.
All right, that's awesome. Thank you. That's amazing. I just wanted to ask. I don't want to be rude, but
No.
it's really an amazing resource to have.
Thank you.
And seems like something awesome available that should be in every school. Have you worked with the other schools in New Milford or just at the high school?
When I started in March, I worked at Schaghticoke. So I worked at Schaghticoke till the end of the school year. And then one of the other advantages, like over the summer, because I work for an agency, over the summer I was able to see some of the students from Schaghticoke and New Milford. So I saw a total of 8 or 9 kids that I had engaged with in the spring at the agency in the summer.
Oh, yeah.
Some of it was through telehealth, and some were in person.
Yeah.
So, and I will do that again come the summer, so they don't have to stop if they don't want to.
Yeah, so it's really expanding that resource. It's starting within the school and it's going beyond that even. Wow, that seems amazing. How can like I as a student or like us as the youth agency help promote these services and make them widely known throughout the school?
I think, like word of mouth with your friends. If people that you know are, could use support, you can mention it. I think that's really the best way that word spreads as people know the services more. I think the teachers are getting to know, because I'll sometimes call and they know who I am, they recognize me now. But I think amongst your peers, if you know someone who could use support, you can, encourage them to check it out.
Yeah. Do you have any advice on how to approach friends who you want to help them get help, but you don't want to offend them?
Right. Well, you can say, it's always hard because you don't know how people will perceive it. But I think you can say it seems like you're struggling. I didn't know if you knew, but there's a school-based health center. There's a counselor here. You can show them the resources. There's, like I said, right outside my door, there's a bulletin board, and people can read it, read what the services are. They can kind of get familiar with it. Last year, something that I did in the spring was I participated in the health fair.
Yeah.
So that really, brought some attention because the students that came through, we had an interactive kind of table with a raffle and some questions. So that drew some people in. So I think having visibility in that way in this school is also one way to have people know about the service.
Okay. Yeah, I think that's awesome. And I wanted to ask, is there any advice you have for students who want to approach parents about seeking help or about accessing these services?
Right, because I have, ironically that you say that, I probably have 4 students who self-referred. So they actually went to their school counselor and said, I want to talk to the person.
Yeah.
This is in the very beginning, and they got them to me. So I think the students, told their parents, I really feel like I need to talk to somebody. And so sometimes it's just taking that chance and saying, I've been struggling. Many times parents are aware. Some of the students that I've worked with have had counseling before. Mm-hmm. Either their counselor left the agency, retired. Some counselors were only doing online and the students didn't want that. So their parents were aware of the need anyway. Mm-hmm. So I think the biggest thing is to not be afraid. And if you have someone who's a support person, maybe they could help you tell your parent, hey, I feel like I want to talk to somebody. Mm-hmm. And just take that leap of faith.
Okay. Yeah, thank you so much.
Oh, you're welcome.
I think that's very valuable information and advice. Thank you. Is there any last words or anything you'd like to share?
Well, I always have a lot of thoughts.
Yes.
And I think, one of the things people say, maybe a little bit about what counseling is. It's not just talking, it's learning things. So, for example, learning a strategy, learning what your triggers are. Like, for example, many of the kids that I do work with have anxiety of some sort. Mm-hmm. So it's identifying what are my anxiety triggers and how can I work with them. The other big takeaway, because I was thinking about this last night, the tendency of people when they feel anxiety, what do you think their tendency to do is? Like if something is causing anxiety, what do people tend to do?
Probably deny or distract themselves.
Right.
Yeah.
Distract or avoid, right?
Mm-hmm. Yeah.
So what happens if you avoid a problem?
It gets bigger. It gets worse.
Right. If you avoid homework, it makes a bigger problem, right?
Yeah.
If you avoid a responsibility, but I find it's human nature, just like adults. It's human nature to avoid things, but the avoidance, while it lessens the anxiety in the moment, mm-hmm. it doesn't help get through the anxiety. Mm-hmm. So it just kind of compounds itself. So it's like if you think about fight or flight response, it's, you feel this anxiety and you want to run away, but running away creates more of a problem. So part of what I try to teach is strategies to stay with the anxiety, work through it, and then the more you work through it, you realize you can get through it. You get over it. You can get over it. So counseling is, it's talking, it's learning things to better deal with whatever the issues are that people are grappling with.
Yeah. Wow, that's amazing. I think that's a really good insight as well. To really get people to understand what it is instead of just saying, "Oh, counseling, that's scary. I don't know."
Right. And people, and my other philosophy is we are not just emotions floating in the air. The emotions are in our body. So our bodies feel depression and anxiety. So that can be rapid heartbeat, sweaty palms, headaches, tension headaches. Depression, people can also feel very tired because our body reacts to those things. So some people have picking up some exercise or taking walks in nature or finding what really helps with the body. So yeah, it's recognizing that we have emotions, they're connected to our body, and sometimes we get physical things as a result that we feel in our body. So just finding outlets for that to help.
Yeah, I mean, very literally, mental health is physical health, and it can impact that. And I don't think I realized just how much, but that's fascinating.
It is
and
fascinating.
Also a little scary, but, but that's why it's important to seek resources and seek help and understand what's going on with yourself.
Right, just like if someone was born with type 1 diabetes, they would get treatment.
Yeah.
Right. Well, some people have family histories with mental health issues, and it tends to run in families. I feel like there should be no shame in needing support to deal with emotional issues. There should be no stigma. And I think, if anything, that would be my ultimate message, is to get over the stigma that maybe you feel or that someone feels that prevents them from seeking help.
Yeah.
Because just like there's no stigma if somebody has a seizure disorder, they're not going to ignore it, right?
No.
They're going to do something about it. well, this should be no different.
Yeah, yeah, it really shouldn't be. And I think that's good that the services provided with the school-based health center are mental, and there's also like medical ailments and illnesses in that sense as well. Because really, they're two sides of the same coin. They're both as important and important to address.
Right. Right now in New Milford, it's just the mental health component that's there. So we're hoping that as time goes on, because there needs to be some renovation in order to accommodate what is needed for the medical component, because they need to have a sink, they need to have certain licensing requirements because it's a health regulation. Hopefully that'll come down the road as well.
Yeah, this resource is very important and valuable, I think. Yeah. Thank you so much for coming here and talking with me. This is amazing. I'd love to learn more about this.
And thank you for inviting me.
Yeah, of course. I think it's important to share.